Hello and welcome to Jack Health Talks Trends 2024. I'm Katie Brown and I'm here with Aileen Wong, Lindsey Flanagan, and Jamey Hardesty. Shall we get started? First question. How do you think we'll see AI implemented in healthcare this year? Is there a potential application that has you most excited?
As we dive into this one, we should probably think about a framework and how we want to talk about this one. There's really three ways that we think about AI in healthcare. And the first is short-term optimization. The second's long-term transformation. And the third is profound learning. And we'll sort of break into these three areas as we talk about it over our responses. But I'll pass it to you, Lindsey, to share a little bit more about some of the things you're excited about in short-term optimization.
Yeah, what I'm seeing is that where AI is doing well, it's for what it does well outside of healthcare. Where we are yet to see much major happening is the decision making. And that is probably going to be the next step. Where brands are really going to own the space is where they are going to currently own trust with their summarization, short-term optimizations. And then they can use that to build trust in the future so that people trust their decision making, because in healthcare, trust is so important.
Once you've been able to build up some of that trust, AI is really set to fundamentally change how healthcare, in particular, how healthcare systems operate and really how patient care is delivered. One of the key areas is personalized medicine. And this is where AI can really integrate different information and factors and really think about like individual health data to tailor treatment specifically to those patients. This approach is really expected to drastically improve treatment outcomes, really by targeting the underlying causes of disease rather than just managing symptoms. Or at least I think that's the hope. There's a lot in the works, I think, for long-term transformation, and this is just the beginning.
We are out quite a bit yet from some of this stuff of the real potential of the profound learning piece. But there's so much incredible data out there. We're starting to figure out how to really collect data at scale. Once we've collected all this data, how do we begin to start pulling it all together to connect all these dots? And then once you've connected those dots, how are you using AI to pull out those insights in a way that you're doing it at scale, that it's so seamless that it's doing it in a way that humans couldn't even do it in 100 years, right? That's where all these breakthroughs are really going to come. AI is able to sort of run in the background, and there's a lot of things to figure out between now and then. It's going to take a lot of partners, a lot of collaboration to do it, but the potential impact could be truly, truly profound.
What is the potential of personalization across brand experiences, both digitally and through IRL experiences?
Personalization and hyper-personalization really have a lot of potential because they allow brands to deliver tailored experiences that really resonate deeply with people's individual preferences. So I think, these types of experiences are only going to become more prevalent in our lives. And think about the data that's also gathered across those different touch points. I think AI can help predict user behavior and preferences, and also enable brands to present even personalized offers and different types of content.
Pharma and healthcare brands are creating content that's actually specific to the journey that people are on, being actually able to pull the right lever at the right moment with the right content, and whether that's branded or unbranded or even above brand type messaging and content, truly being able to move people to the right place at the right moment in that journey is really the promise that content will be able to deliver on.
Healthcare conditions can be very isolating. They can make you feel very alone. So for creating a sense of community, personalized experiences can be great, especially in the live space, but you have to be very careful with omnichannel. Personalization is great for knowing when to talk to somebody, how to talk to somebody. What you do not want to do is make somebody feel like they are being targeted because they have a healthcare condition, because that can feel super invasive. So there's many fine lines in this that we will probably talk about, but personalization has to be done properly in order to make people feel safe and to engender trust into that brand.
And last question, are there specific challenges or ethical considerations unique to healthcare that need to be addressed in the pursuit of hyper-personalized content and experiences?
That interoperability piece today requires a significant amount of skill because these are really big IT problems. And so the names that are involved in this are really big names, right? Google, Apple, Microsoft. And that brings with it a whole different slew of challenges, opportunity. But these are different names and companies with different incentives than what the healthcare system typically operates under.
With healthcare, the worst case scenario is that somebody dies. Not to be drastic, but when you are creating models, when you're creating learnings that could change the way somebody is diagnosed or treated, then that could cause a danger to patient health. So very first baseline is that you do those assessments, you do take care of those risks, you do constantly monitor and do the checks to make sure that what you're doing is the right thing for your patients, for your customers.
I think another area of consideration that we're seeing with AI and even just hyper-personalized content is bias and discrimination. So I do think AI machine learning models can inadvertently perpetuate those biases if they're trained on non-representative data sets. And this really can lead to unequal treatment outcomes where certain demographic groups may receive less effective or inappropriate care. And I think it's going to be crucial for us to ensure that these AI systems are developed and tested on more diverse data sets and to really fight back against this bias that we've been trying to do for quite some time. But it's going to take some pruning.
Great. Well, thank you all so much for your thoughts and insights. And thank you to everyone for joining us at another Jack Health Talks 2024.